Linda Anderson has our program today. Linda.
So anyway, just wanted to update you on all that. Our program today is a part of the World Service Project Committee that I think a lot of folks have been involved in. Wiley Dobbs, Autumn Agar, Jody, Dr. Wurst, if he's here. I got involved late, and Autumn had brought, I believe, 5 organizations for us to consider as far as supporting which ones of those we want to support. And we've asked the various nonprofits to come and make presentations. Well, today is one of those presentations. I have the really distinct pleasure and honor, but mostly pleasure, to introduce Jeanne Dillner, who is the CEO of SIGN. SIGN is an acronym, and she will tell you what that stands for. Jeanne is also one of my best friends, but also my sister-in-law. So I know what Jeanne has has been able to accomplish in the 14 years, I believe, that SIGN has been in existence. They formed by an orthopedic surgeon based in Richland, Washington, up in the Tri-Cities, formed SIGN 14 years ago to help provide assistance to people who had bad accidents in what we used to call third world countries. I think we call them developing countries now, who couldn't afford the type of care that we typically could afford here in the U.S. So Dr. Zirkle saw a need and he stepped in. So Gina is an accountant. That was her training and her education, and she and her husband had moved to Richland, and she met Dr. Zirkle. I think she was his accountant first, and then he realized how good she is at what she does and asked her to become CEO. So Jeanne, I call her Gina. Actually, her real name is Jeanne Dillner, so I would like to ask Jeanne to come up here and talk to us about SIGN and how we might be able to help. Thanks.
It's fun to be in another Rotary Club. The Richland Rotary Club, we do lots of fun things like you do, but I really like, Kevin, that card of inviting another potential member. That's a really nice placard to give to somebody, very professional, and very impressed that you're passing the bucket around. Melinda told me that somebody is matching whatever you raise to help with this particular project, so that's very impressive. Melinda and I have known each other for quite a while, and I haven't developed the best relationship with her simply because I travel around the world a lot and I'm really tired and grumpy when they call me on the weekends when I just want to sleep. But so I am involved with an organization that has changed the face of orthopedics in the developing world. Our founder, Dr. Zirkle, has been training orthopedic surgeons and really is called the father of orthopedics in several developing countries because he's been doing it for more than 40 years. And about 20 years ago, he realized that he can't just go and provide training, that he saw a patient that his trainees knew how to repair the person's injury, but because they didn't have access to the right kind of orthopedic implants, which we will just call them the nails, they didn't have a supply of those, only if he were to come. So he realized that he has to match the tool with the training so that the local surgeons can care for their own patients. And that's the way that we're preventing disabilities in many countries throughout the world. SIGN is actually SIGN Fracture Care International, and what our dream, our vision is to create equality of fracture care. Let me see if I can work technology. There's something on the left I'm supposed to push. It worked. So our mission is to build orthopedic capacity, and we do that by providing training and education and a continuous supply of these nails that we manufacture in Richland, Washington. So we design and manufacture this product, and we give it away to the hospitals and the surgeons in developing countries. So let me contrast. There are some organizations that go overseas and they provide 2 weeks of surgery for a hospital full of patients. But the local personnel don't get too involved because the traveling organization brings all of the surgeons and nurses and anesthesia. So what happens 2 weeks, the week after they're gone? Well, the local surgeons are discouraged because they can't provide that same care. So that's what we do. We provide them with the tools so that they can be encouraged and that they can see the smile on their patients' faces. We are in the poorest of the poor countries. We are in 56 developing countries throughout the world. And I'm a Rotarian. Clubs in our area have provided funding for us to start programs and to resupply programs. So I'm very proud of that relationship. But I'm particularly proud of peace through service. That motto really rings a bell for us because I've personally been to Afghanistan and Pakistan where there's a lot of conflict and where some of the Taliban might not like Americans. But once they meet us, they realize that the healthcare people really, many people in the world want a better life for everybody in the world. And so we're that ambassador of friendship and healing to many places in the world. I don't know how many people here have been in Asia, traveled to Asia. What's the traffic like?
It's pretty congested.
It's scary, isn't it? Yeah. So there's a Rotary, I'm very proud of this too. I've seen polio patients. We're working to eliminate polio. And other organizations are working to eliminate AIDS, eliminate and care for the people with AIDS, and eliminate and care for the people with malaria. But nobody is working to care for patients that are affected by trauma. 90% of the road traffic accidents, there's 20 to 50 million road traffic accidents that happen every year. And the result of that is that there are more of those types of deaths and injuries and permanent disabilities caused by that than all of the other diseases combined. 90% of them are happening in developing countries, but 80% of the people that can care for those types of patients actually live in America and Europe. So there's a big inequality. And what our organization is doing is trying to balance the scales a bit so that the local surgeons and the patients can get better care. But those of you who've traveled abroad, somebody tell me how many people are on this motorcycle. Do I? 6? Is there any other number? Any other number? There are 8 people on that motorcycle. That motorcycle was built for 2 Asians. There's a bunch of Africans on it, and they're bigger. Even if they're little kids, they're bigger. So, and they're not driving on nice paved roads. Like here, even though you're snow covered, your roads are much better than the roads in developing countries. Even in the middle of Dar es Salaam, which is a very large capital city in Tanzania, there's maybe 5 main roads that are paved. The rest of them are dirt roads. And so they're sharing the road. These motorcycles are sharing the road with other cars, buses, bicycles, oxen, all kinds of a variety of moving things. And when they get in an accident, you can just bet that 8 people are going to go into the emergency room at the nearest hospital. And this is what the wards look like. This is what the fractures look like. They're terribly difficult to repair with just casts or what we call traction. You have to have an implant to fix a fracture like that. And these patients are not having access to it. They're staying in bed for months at a time in what we call traction, and they're basically pinned to the bed for that amount of time. So if they're the main breadwinner of the household, then their family becomes destitute. And you can imagine how discouraging it is to be a patient in a ward like that. It's also discouraging for the surgeon because they get on the internet, they know what tools are available to most countries or to the developed world, and they're frustrated that their hospital doesn't have those tools. What happens in developing countries when a patient is injured, then they go to the hospital and their family goes with them. So that means that school-aged children are pulled out of school. The ticket to the better future, we all know, is better education. So these poor kids have to be pulled out of school, and they stay in the floor of a hospital and help their mother or their father to provide the meals and the nursing for the injured person. So the sooner that injured person gets out of the hospital, the better it is for the entire family. Our goal, so we're healing not only a person's leg, but we're healing the family, and we're helping them keep back on track on that path out of poverty. So a fracture like this might turn into a fracture like that if they don't get the access to the right surgical care. But fortunately, we're working with surgeons, 5,000 surgeons throughout the developing world who have the skills and the intellect. All they need is our product to be able to help them do a surgery like this, which is putting this rod into the canal of your leg and then holding it in place with screws that interlock here and here. And that way the nail doesn't move into your joints. So anyway, it allows the stability, because you need a little bit of movement for the bone to heal, but a lot of movement causes what's called a non-union or infection, and so then the person loses the use of their limb. So in a very real way, when a patient gets treated by a hospital that has access to Sign products, we're giving them a lifetime of walking. So the people who support Sign, who donate to Sign, and the surgeons overseas who work with us, work together healing thousands of patients every year. Let's talk a little bit more about what extreme poverty is. Tell me how much food you can buy for $2. Just tell me, can you go to McDonald's? What can you buy at McDonald's? Can you buy a Happy Meal for $2? I know you can buy a hamburger, because I'm cheap, so I buy the 99-cent burger. But I can almost get a burger and a large Diet Coke for $2. What about 12 eggs? Can you get 12 eggs for $2? You can? What is it, $1.98? Yeah. So how many meals can that tide you through? So I tell you what, in developing countries, well, half of the world's 7 billion population are living on less than $2 a day. So these people are desperately poor. And they're lucky if their kids get the meals that they know that their kids need for nourishment and to grow and to be able to have good minds to learn in school. But here's another example of extreme poverty. This is a young man who I met last May in Kenya. He, 2 years prior to this photo being taken, was injured in a road traffic accident. So he was hit by a car, he was on a motorcycle, and it caused a break in his tibia. The tibia is where your shin bone is. And that break caused his skin to open. So that hospital didn't feel comfortable putting our intramedullary, didn't feel comfortable doing a surgery till that wound had healed all the way. So what they did was they gave him if you look on the left, the picture on the left is a picture of what's called an external fixator. So he went home with that metal device on the outside of his leg to try and keep the bones aligned until he came back. And the doctor said, come back in 3 weeks, and that wound will be closed, and we'll be able to give you a free Sign nail. We'll be able to do that surgery at no charge. So the problem is, this guy lived 100 miles away. And the surgeons, when he finally came back 2 years later, they said, well, why is that? Why did you take so long? And he said, well, I live 100 miles away, and I had to find odd jobs that I could do while I'm disabled to be able to get the $40 I needed for the bus fare to come back to get the free surgery. That was like a slap in my face. I didn't even think about the logistics aspect of the patients coming back and forth to the hospital, and it made me that much more proud that we have so many people that support Sign that we are able to give this free nail so that he could have an opportunity. Otherwise, he'd be feeling like he didn't have any chance of healing. So, by the way, in his case, he was able to get out of the hospital within a couple of days after the Sign surgery, and now he's on to a normal life and normal activity. So here's what I do every day. Besides when I'm in country, I am overseeing the design and manufacture of FDA-cleared orthopedic implants, and we have a variety of types of, these are called nails. We have a variety of kinds of those. And we can help about 20,000 patients get back on the track of walking with the capacity, the number of staff that we can hire. Our capacity of our shop is more than double of that, but we're very proud of our product. We've received manufacturing awards because of the combination of the product that we have and the jobs that we've created in the Tri-City area where we live, and also because of the mission that we have. But there's the areas of the body that our current product line repairs. So the tibia, which is your shin, the femur, which is your thigh, and the humerus, which is your upper arm. And in fact, this young woman is our very first poster girl. So this was in 2001, where she had to have surgery on both of her tibia and her femur. Her femur was so badly injured that they tried for 6 months to heal it in traction, and they couldn't. So they were just about ready to give her an amputation, which would have meant that she probably would have never gotten married, never been able to get a job. But they came in and they decided to do the case, both the tibia and the femur at the same time. It never had been done before, maybe worldwide. It was a very new type of surgery. And here she is 6 weeks. She'd been in bed for 6 months. Here she is 6 weeks later standing on the leg that was injured. So we felt like that is some kind of miracle. We talked earlier about how wonderful it is in the Rotary Minute, how a small group of people can make such a big effect in the world. So we have about 30 staff, and we're all working together to make a huge impact and to supply the 5,000 surgeons worldwide so that they can care for thousands of patients every year. Our training model is probably similar to what it's like to be training a resident here in the United States. So the first surgery, we go in and we go to training centers. So we go to hospitals, university hospitals that have residency programs because they're used to training people. So Dr. Zirkle or other surgeons who volunteer will go over and they'll do the first case, showing them how the procedure is done. And then each case after that is done more and more by the local surgeons. So we'll train a core of the local surgeons, and our expectation is that they will then train the rest of the orthopedic surgeons or general surgeons in that hospital to do the same procedure. Then when word gets around, they're already a full hospital. Things ease up because they're able to do more cases per day than patients are coming in per day, so the wards clear out. And then they start filling up again. And they do that because the patients start hearing that you get really good care at this hospital. So then those local surgeons write to us and say, can you please start in more programs, because we need to have some help here. We need more hospitals using Sign. So that's how Sign sort of organically grows. Then the local surgeons are the ones training the new surgeons. So we have a core group of about 30 U.S. surgeons that go over and provide training, but really the biggest trainers are the local surgeons who already use the Sign nail on a daily basis. We talked about peace through service, but I just thought I'd show you this picture. Every year we have an orthopedic conference that's held at our facility. We have a big enough event center in our facility to hold this. And we see faces of all different colors. These are Muslims and Christians and people of all walks of faith and all areas of expertise that are kind of huddled together, 150 of us in a room together for 4 days to talk about better ways to treat their patients using our products and other orthopedic techniques. And it's an invigorating time. Our staff get to meet the people that they're making the product for and hear of new ideas and new products that are needed. So since we began in 1999, together partnering with the surgeons overseas and our staff, we've been able to help almost 110,000 patients. Nearly 300 hospitals are using our products, and we're just started in Darfur, Sudan, this year, so we're at 56 countries now. So we're going like gangbusters. And the results, how do we know that we're doing well? How do we know that the patients are doing okay? And how do we know that they're using our equipment okay? Well, we're giving it to the hospital, and we don't call ourselves a charity to them. We call ourselves a partnership, because what they're required to do is record their results in our database. The only way that they get replacement nails is for every nail or every case they record, they get a replacement implant for it. And you can see there's x-rays down there. So we have orthopedic surgeons that are in the United States that are looking at those x-rays and commenting back to the surgeons about their cases and answering any questions. And the other thing that we find out is that the surgeons are using it for beyond what we had originally designed it for. So that causes us to, several years ago, we saw that they were using it to fix hips. So then we decided we needed to develop better equipment for them to have a better outcome from using our sign nail. So we added some devices for them to be able to do that. And what's interesting is that, we think of hip replacement as being for people who are in the well, I'm a baby boomer, so we're never old or elderly, but in the higher numbered ages. But actually, I met a girl in Myanmar who was 20 years old and needed a hip device because of where the car had hit her as she was crossing the street. So it's 20 to 90 are the ages of people using that device. Then we took a look at our database and saw that 10%, this was a few years ago, 10% of the people in our database are 18 years old and under. So there are children already receiving the sign nail. But there weren't any like 12 and under. So we decided it was time to, especially if you think back to that one slide where there are 8 people on there, and most of them were children age. So we knew we needed to answer the call to help the little kids. So what we did was we developed a pediatric nail. And this is Martha. She's the little girl who got the first pediatric nail in Tanzania. And it's really wonderful that we were there at that time because she's an orphan. Her parents died of age. She lives with her grandmother. And her grandmother would have never been able to come up with the money to pay for that, any kind of implant to help her. The other thing that's really special about this story is that Martha got injured during a school break, and if she'd not been able to go, had she been put in traction for 3 months, she wouldn't have been able to return to school in time, and she would have had to restart that year all over. So thankfully, she got this little pediatric nail put in her, and she was able to return to school on time and be first in her class. And here's a picture of her in her classroom with her friends. And my husband and I she charmed me, and so I charmed my husband into convincing him to helping her to go on to a boarding school, which would allow her to obtain even further years of schooling and be able to achieve her dream of being a teacher. So Melinda already explained to you that members of your club are already interested in supporting sign, and so they will present that to you in the future. But I guess you can hope by being open-minded to the idea that you could help us providing support for a district grant, and I look forward to hearing the results of your vote in a few weeks. But anyway, I really thank you for giving me the time to tell you more about our organization. And I don't know what time it is, so I don't know if there's time for any questions, but if there are, I'd be happy to entertain them. Okay.
I have a question.
Okay, yes.
Are these implants or nails, whatever you call them, I don't know. What are they made out of? Titanium?
We make them out of stainless steel. The first countries that we worked in were in Asia, Vietnam, and Cambodia, and they like to have them removed. So titanium, the bone is more porous, and the bone grows into it more, so it's more difficult to remove. It's also more expensive. So because we're giving them away, we had to watch our costs.
Yeah,
and they were originally...
That's really the ultimate thing I was coming to, because I have a friend that just had one titanium put in, and he said it was $2,500.
Thank you for pointing that out, yeah.
And so I wondered how in the world you could be...
So what we do is, if you were to go to your hospital, and no patient in a developing country could afford a $2,300 implant. And what we do is we're providing them an implant for free, but it probably costs us about $150 a patient to care for. So that's why we're grateful to our donors for that. U.S. companies have a lot. They have to send theirs out sterile, and they have to pay people to do the marketing and stuff like that. We're just going directly to the hospital. So and people are asking us to start programs, so we don't have a lot of marketing that we have to do other than for fundraising. Oh, I'm sorry.
So how unique is your product and your company? How much competition do you have in this field?
Okay, so our company is unique because we're really the only nonprofit organization that trains and provides the product so that the local surgeons can do it. What usually happens is with any any organization or any hospital overseas, they get a lot of donated material, and they have to sort through that, and then the right sizes aren't always there, and the right instruments aren't always there. So our goal was to give them everything they needed to be able to do the surgery and to resupply. The device itself is unique because in the United States, you need to have a C-arm, which is real-time imaging in the OR, in the operating theater, in order to be able to implant those interlocking screws I told you about that are down here. So the surgeon has to be able to somehow either tactically or visually through an x-ray know where they're supposed to put those interlocking screws by thinking or looking through the flesh and the bone. So x-ray does that, but we've developed a mechanical targeting device that allows them to do it without the C-arm. A C-arm costs about $150,000. Local hospitals in developing countries don't have that money. Lots of people donate C-arms to these hospitals, but C-arms have to be calibrated and they have to be maintained. And they don't have Siemens or Philips representatives in these countries to be able to do that kind of work, even if the hospital had the money to provide the maintenance for it. So because we're founded by an orthopedic surgeon, and he's very creative and loves to tinker and loves to design things. We've got the best system in the world for the areas of the world that we work. We do use it in our local hospital as well. And there's other universities who have global outreach programs who want access to our device for their training programs so that American residents can be better trained to go overseas and provide assistance worldwide. Somebody else over here had a question. Yes.
Well, because you provide the devices to at no cost, how do you fund your facility and your workers?
Through donations. So we have, majority is through donations, but there are other nonprofits that have hospitals who buy from us. Anybody hear of Doctors Without Borders, Médecins Sans Frontières? They purchase the sign equipment from us. Cure International, Emergency, which is another organization out of Italy. There's probably about 10 nonprofits that are, and we sell it to them we know what it's like to be a nonprofit, so we sell it to them basically at our cost. And then Vietnam, that girl that I showed you, their economic situation has improved dramatically, so the patients are able to afford a inexpensive nail, so we sell through a distributor there, and he keeps the price down enough for the poor patients to be able to pay. Any other questions? So that's like a third of our revenue or income, and the rest has to come from donations. Yes.
Well, I guess my question is what's the potential market in the developed countries for this product? If it works so well in people just like us, so what is the potential for doing something in this country or other developed countries that would drive down the cost of medical care because this product is much less expensive to produce?
There's a lot of discussion about that. One market might be second world countries for us. Another might be the U.S., but that's why we're excited about universities wanting to work with us, because the residents are people want to use what they know how to use. And this is, to them, a brand new idea, even though really 30 years ago, everything was made out of stainless steel, and you didn't have C-arms to implant it, and you still succeeded. So it is a discussion that we have. It could be, we are patented, so it could be that a for-profit implant company would like to license it from us and then sell it in the United States.
It's FDA approved, you said, I think.
Yes, it's FDA cleared as well, yeah. So we have those discussions, but it means we'd have to set up, if we were to sell it, we have to set up the marketing people that I discussed earlier, which our focus is on the poor. But there are opportunities, and we do meet with other companies who are interested in our product. Anything else? Well, thanks, everybody. This is a good crowd. I really appreciate the time.